Hello friends, today I'll be talking about the scope of Pharm.D in India. Basically, the Pharm.D course has been introduced by Pharmacy Council of India along with the B.Pharm and D.Pharm course. This course is basically hospital as well as clinical operation oriented course where the main emphasis is given on the utilization of medicine along with the preparation, standardization, clinical evaluations as well as the new label as well as off-label use in the patients. Pharm.D has a vast opportunity in the hospital as well as research center based jobs. So basically those hospitals who have been accredited with the NABH, that is National Accreditation Board for Hospital and Healthcare Providers, and Joint Commission International JCI accredited hospitals. They are equipped with the very good state-of-the-art facilities, and the Pharm.D has a good opportunities in those hospitals. Talking about the positions, various hospitals have their own new openings, starting from the clinical pharmacologist, clinical pharmacist like jobs, where clinical pharmacist has to audit the prescription, do the medical ward rounds along with the other healthcare professionals, and to identify the medical related discrepancies, and also has a very vital role in adverse drug reaction reporting, assessment, monitoring and prevention. Apart from clinical pharmacy related scope, there are emerging area which is called clinical fellowships, which is nowadays getting more attention for the Pharm.D graduates. Pharm.D graduates along with the MD who have completed MBBS and then MD are eligible for these clinical fellowships. To give an example, Tata Memorial Center in Mumbai is having opening every year for these clinical fellowships where all Pharm.D graduates can apply. But these positions are very competitive and one should have a very vast knowledge in this specific field where they are applying, then a good opportunity can be grabbed by the Pharm.D graduates. Industry and clinical operation based opportunity, when we talk about, there are so many opportunities Pharm.D graduates can have, starting from the clinical operations, on-site job opportunities. As a clinical research associate, Pharm.D graduates can enroll in any clinical research organization where they can contribute actively in recruiting the patients for the clinical trials as well as clinical research. It is an opportunity where a person has to move from one place to another place. Those who like to travel, they can definitely go for the clinical research associate job. It is having a very good future as the chances of getting high salary when you jump from one company to another company is very high. Talking about the clinical operations off-site jobs where the clinical data management is one of the biggest opportunity any Pharm.D graduates can have. As a clinical data management, there are ample of clinical data gathered from the clinical trials as well as clinical research need to be processed and certain fruitful results need to be obtained out of the data. That can be achieved by the clinical operations off-site based management where Pharm.D graduates are eligible. Talking about the emerging field, pharmacovigilance, where the growth is comparatively slower compared to the clinical operations. In pharmacovigilance, as a drug safety associate, the processing of all the adverse events occur during clinical trial as well as after the post-marketing of the drug can be processed. Talking about a new emerging area is health economics and outcome research, that is HERO. The biggest challenge is in India there are very few companies offering this job, but this is the very new and innovative area where Pharm.D graduate can explore. The starting position would be like junior analyst or market research analyst, and after getting sufficient experience from the domestic companies, one can move to the international companies and can get a very good salary in this field. The another opportunities are like medical science liaison, where the business related development are required and the pharmaceutical industries will hire those a person who is having a very good knowledge in the clinical field. I like to give example that a company which is preparing some antibody drug conjugates are hiring those medical science liaison people to promote their drug in various disease conditions. Another field is health informatics and bioinformatics, where the data related to the various drug pharmacokinetics will be processed and used for the personalized care. So that can be a good opportunity for the Pharm.D graduate. Pharm.D graduates are also in demand when it comes to the pharmacokinetic studies. BA/BE studies as well as biosimilars are nowadays produced by so many pharmaceutical industries, where the clinical trial has to be performed but not that much stringent of the molecule which is not known. So Pharm.D graduates are required in pharmacokinetic divisions where they can estimate the time points where the blood need to be withdrawn and to calculate the drug concentration at a certain level and to decide the dosing of the drug in various junctures. So pharmacokinetic is the new field where Pharm.D graduates can explore and can progress. Pharm.D graduates have ample opportunity in project-based jobs. Say for example, as a junior research fellow, the Pharm.D graduates can join any clinical related project which is funded by ICMR, that is Indian Council of Medical Research, National Institute of Virology, National AIDS Research Center. There are different kind of projects sanctioned by these national bodies where Pharm.D graduate as junior research fellow can apply and work with the very high salaries. For the Pharm.D graduate, CSIR UGC NET is the competitive exam necessary to be qualified for the junior research fellowship position. Along with the junior research fellowship, Pharm.D graduates after completion of Pharm.D are eligible for enrollment in the PhD. So it is one of the good opportunity for Pharm.D graduates. After completion of 2 successful years in junior research fellowship program, they can be promoted as a senior research fellow. Apart from these positions, another project-based opportunities can be as a project technical officer, where these Pharm.D graduates can contribute in screening of many research proposals as well as scientific literature and then forwarding to the specific division like life science, chemistry, biologicals. So this is the project-based opportunity any Pharm.D graduates can grab. Now the miscellaneous opportunity related to the industry-based jobs are medical writing and scientific writing, where the scientific literature need to be prepared for the company product, whether it is medical device or medicines. It should be prepared by the medical writer or the scientific writer who is having some sufficient knowledge in the regulatory as well. Pharm.D graduates are also eligible for medical coding, where the coding of the specific drug or the event should be given so that throughout the world everyone can percolate the same message for the drug related safety and efficacy data. Talking about the academic role of Pharm.D graduate, as per Pharmacy Council of India, Pharm.D graduates are eligible to teach in Pharm.D course, where they can get a good salary after completion of maybe their Pharm.D or after completion of Pharm.D and PhD. And Pharm.D graduates are also eligible to directly enroll to the Doctor of Philosophy, that is PhD course. So these are all about the various opportunity Pharm.D graduates can have in India. There are wide scope of opportunity for Pharm.D graduates in the developed nation like US, Canada. We will talk about that later in the next video. If you have any other queries related to Pharm.D opportunities we have discussed in this video, or any other Pharm.D related matters, please let us know by commenting in the comment box and we will try to justify and answer your queries.